Good afternoon, everybody. My name is Teresa Castro, and I'm a proud alumna and staff member in UNC's Office of Alumni Relations. Thank you all for joining us today for the Alumni Career Panel, Careers in Healthcare Services. Today, we will learn from and connect with fellow UNC Bears working in this industry. Before I introduce you to our panelists, I would like to share a few housekeeping items. First, this event will be recorded and will be available on demand a week after today on the alumni website. I will post a link in the chat. Two, I invite you all to start building your network and reach out to our panelists after the event. I will also post your contact information in the chat towards the end of this virtual event. And third, I will go off screen after introductions and will return towards the end of the event to provide a closing statement. As we highlight the careers of these alumni, I invite students, fellow staff, and faculty to ask questions via the Q&A feature. Now, please help me welcome our panelists. Panelists, please introduce yourself by stating your name, your pronouns, your title, the organization you work for, your UNC degree, and a little bit about yourself. Brian, we'll start with you.
Hello, everybody. My name is Brian Davidson. I am a 1999 graduate from UNC. I was a chemistry major. I'm a physician, went to medical school at University of Colorado right after medical school and was faculty there and ended up moving into an executive role that requires me to be a physician. But I've kind of done lots of different things in healthcare, and I look forward to answering questions and learning about the other panelists.
Thank you, Brian. Sophia, how about we go to you next?
Hi everyone, my name is Sophia Nimmo. I graduated from UNC in 2021 and I am a pediatric oncology and bone marrow transplant nurse at Children's Hospital down in Aurora. And I am a Colorado native and have lived here my whole life and I love what I do and I spend a lot of time with friends and family.
Thank you, Sophia. And Jessica.
Hello, friends. My name is Jessica Elena Rodriguez. I am a former UNC alum, class of 2020, for my undergraduate degree in biology with a pre-health emphasis and minors in sociology and chemistry, and then decided to keep being a bear and completed my Master of Biomedical Science as the class of 2022. I am currently the QI coordinator / one of the many trainers here at Sunrise Community Health, teaching medical assistants how to do their roles and responsibilities, as well as a certified medical assistant myself. A little bit about me. I'm a Greeley native through and through. Been here and I feel like the universe won't let me go. So I love being here. And I'm a proud Latina in STEM, just advocating for everyone and anyone that needs that advocacy and push within different diverse backgrounds. And I'm happy to be here. Thank you.
Thank you, Jessica. And Alicia, why don't you close us out?
Perfect. Hi, everyone. My name's Alicia Trujillo. I'm actually from New Mexico. I went to UNC in 2020 to pursue my master's degree, so I'm also an MBS graduate. Graduated in class of 21. I'm currently a second year medical student at the University of New Mexico School of Medicine. And I hopefully want to become either an emergency medicine physician or an orthopedic surgeon. So I'm super excited to be here with all of you, and I will be today's moderator as well.
Thank you. Go ahead.
Okay, perfect. So, the way this is going to work is I do have the Q&A pulled up on my screen. We have a list of some preset questions, so I'll just read off some of those questions and I'll call on the individuals who I hope can answer that question while also looking at the Q&A in the chat, okay? So, for question number one, we're gonna have Brian, Sophia, Jessica, and then myself answer this one. So we'll start with Brian and then, go in order. So the question is, how did your experience at UNC help prepare you for your career in healthcare? And what skills or experiences from your time as a student do you still rely on today?
Great question. I really enjoyed going to UNC. I fit well there. I was a traditional first generation student, and I say traditional. My mom went to college for 1 year at CSU and then went back to college when I was in third grade and graduated when I was a junior in high school.
Yeah.
My dad was a firefighter, so I was the first one to kind of go to college where you actually went and stayed there and lived in the residence halls and all that. So UNC was a good pick. Small classes, excellent teachers and education. I will say I'm in my executive role today directly because of UNC. I ran for student government my junior year, never had running for anything in my life or even have an interest, but that parlayed into some other things in leadership, um, which is why my career went from being a clinician, which I still am, but also business and leadership. And I directly relate that back to experience at UNC.
Perfect. Thank you so much for that. Sophia?
This is a really good question. I was also a traditional student at UNC, and I had also transferred from a school previous to when I started at UNC. But as a nursing student, we did a lot of clinicals on campus, and in the Greeley area. So we were doing like hands-on things in our clinical lab before taking it into an actual clinical setting. And we got to do that both like up in Greeley and at other areas like in Fort Collins in hospitals in that area, and then also coming down to Denver to hospitals down here. Um, but it was a great place to like build the fundamentals, to like know the basics, and then be able to expand on that as I moved into like my own specialty.
Perfect. Thank you so much. All right, Jessica?
Yes, so I'd like to say that UNC became the catalyst for setting my career and hopefully um, my applications as I am currently applying for medical school. And I will do plan to put one of those applications towards UNC's upcoming osteopathic school of medicine. So again, I'm joking that I'm stuck here, but it's a good stuck. But UNC pretty much, if anything, set my purpose more into fruition than what I had before in high school. My going into college story is a very interesting one to say the least. As a first generation student, being the first one on both sides of my family to not only go to college but also graduate high school was a big weight on my shoulders to kind of keep pushing for higher roles in education. I had actually originally planned to go to CU Boulder and moved out there and everything and was out there for about a week or so. But due to some financial, family things going on, but also, I guess I'd say lack of inclusivity out at Boulder at the time, um, pretty much did a 180 flip the weekend before classes began. And luckily, through some connections with Greeley Dream Team here in the Greeley Evans area, and just some support from some former faculty at UNC and people that I know, they helped me to go into UNC and not wait the semester gap or just a gap at all. They were like, all right, you're going to college. You want to go to college, so let's get you into college. I had applied to UNC, so the application was still open. And within a weekend, my entire life switched over. But I always say, in a series of happy accidents, is how my life has been credited to be. And in that weird, crazy, hectic, trying to figure out how to find a dining hall to what dorm I'll be staying at, I ended up embarking and joining the LEAP cohort, which is UNC's Learning Through Engagement and Authentic Practices cohort, which is a program that is set for first generation underrepresented students in STEM related degrees that want to pursue some form of higher career, whether it's becoming a physician, a pharmacist, dentist, anything like that specifically. And it became probably the best way for me to stay on campus through difficult times and a lot of challenges as a first time student, but also as a Latina student and navigating that perspective as well. It became the foundation for me to kind of keep pushing myself to keep going, but also having that support network. They communicated with different faculty and staff on campus, as well as trying to get us to do different programs, different shadowing opportunities. They connected us actually with Sunrise to shadow physicians here, as well as going to different ways for us to interview or just get connected with people, which is a great way. And for anyone on this call that might be in high school and wanting to go to UNC, it's a great first time program that I definitely recommend and something that I still keep in contact with, whether it's prior faculty and advisors, but also the people within my cohort help to allow to make more bonds with everyone. And I joke that from us, during school, focusing on trying to get our 11:59 p.m. deadlines in on time, it now is to celebrating each other's weddings, births of each other's children, and just kind of keeping those bonds as we get older.
Thank you so much, Jessica. That was great. All right, yeah. So for my experience, as I said, I'm from New Mexico, and so I did go to undergrad in my hometown of Las Vegas, New Mexico. And this was my last semester of my undergraduate degree was the semester that COVID started. So I was kind of like just looking for something new, and I wanted to get out of my small town. I'm from a very small town. So I went on the AAMC, which is the Association of uh I forget, Academic Associate of Medical something. I'm sorry, blanking on that acronym. But I just looked up some post-bac programs and UNC came up. I had never been to Greeley. I didn't really know that Greeley even existed. But I did put my application in and I was accepted, which I was like kind of surprised about. Because I really just didn't feel ready to apply to medical school yet. That had always been my goal, but at the small college I was at, there wasn't a ton of support for students who were pre-med. So yeah, so I came to Greeley, went to UNC. Also, for those of you who don't know, the MBS program, it's the Master of Biomedical Sciences program. So that program is a 1 year accelerated master's program for anyone who's interested in like a professional health degree. So I was interested in going into medicine. Some people in my cohort were also interested in like dental school and things like that. So yeah, the program was it was a lot, and I remember the first week thinking to myself like this is so different from undergrad. But I really believe it made me a better student in the long run. It really forced me to like it pushed me past my limits and past what I thought I was capable of. And I was able to complete my program in a year and get my master's, which kind of like some of the other panelists, I'm also first generation. I'm the first daughter, sister, granddaughter to graduate from college. And I also have my master's, which is really cool. So, yeah, and even in today's, my day to day, now that I'm a medical student, I see a lot of what I learned at UNC, just coming back. Like right now, in my second year of medical school, we're learning a lot about medical ethics. And at UNC for the MBS program, you're required to take a course on, it's called Biomedicine and Careers, but we talk a lot about medical ethics in that class. And I know a lot of the information because of my courses at UNC. So I'm super grateful for that. All right. Let's go ahead and move to the second question. So, second question, we're going to have Sophia, Jessica, and Brian answer in that order. And the question is, healthcare services offer many entry points and career paths. Can you share how you discovered your path and how you arrived at your current role? And we'll start with you, Sophia.
Yes. So I knew I wanted to be a nurse for quite a long time. I didn't know exactly what specialty I wanted to do. Both of my biological parents, incidentally, have had cancer, and I wanted to become a nurse to give back for the nurses that took care of my parents because they're luckily both still around today. And that means everything to me. So I knew I wanted to be a nurse, and it was just a matter of finding my jumping point of like going to school to get there. And as I like went through clinicals in nursing school at UNC, I was exposed to every area of nursing, not wholly, but a variety of them, to see like what I liked and what I could see myself growing in. And I ultimately figured out that I liked working with kids. And that still was like my jumping point to then find my specialty within pediatrics. And then making it come full circle going into oncology. So kiddos with cancer, as like my way of giving back for the people that helped my parents.
Yeah, that's awesome. Thank you so much. All right, we have Jessica next.
Okay, so I always joke that my way into healthcare was fresh out of the womb. I was born at 6.5 months, so a preemie little thing. Not so little anymore, sorry, unfortunately. But since then, I spent a lot of time with just different healthcare professionals growing up as a kid, to the point where in elementary school, instead of going to recess after lunch, I would have to go to the nurse's station for different asthma, like little activities, as my nurse would call it. But pretty much, I just had a mask on myself for about 30 minutes, and it was terrible. And I was like, I miss the outdoors. And so ever since then, just growing a larger empathy and understanding of healthcare based off of the different people that I've interacted with, but also learning more about everyone else in different clinics and hospitals since a kid. Similar to Sophia, I also have a personal tie to it. My grandfather died of lung cancer when I was one, so never actually met him. But something that stuck with me is when he was about to pass, he told my mom that, kind of metaphorically, in him losing his lungs will continue to me have mine, since I had lung issues as well growing up. And that kind of pushed me into wanting to focus into pulmonology as a specialty. Now, where I'm at today, I've had the privilege of being able to work at a FQHC, so a federally qualified health center, through Sunrise Health Systems, and just in working with them, kind of being able to understand how care is from newborn through end of life, in being someone's primary care physician, and not only shadowing but also then becoming the assistant to different physicians, has been a true great way of understanding. And so now my shift has kind of focused more into either being pediatric forward or just family based centered. And a big credit as well I give to that, just the opportunities that I've had in different roles, not only currently but prior to my work. And also, my mom jokingly made me become a medical assistant, or almost threatened me, I should say. She wanted me to learn how to give shots so I could eventually give her B12 shots. She's like, Mika, you need to learn how to give vaccines so you can do them on me. And I was like, I don't think that's something that OSHA would want, but all right, girl, like, sure. And so while I still do not give her B12 shots, I've given plenty to the tiny humans, as I say, to the larger ones. So it's been a great opportunity and kind of a my own full circle moment as well.
Perfect. Thank you so much. All right, Brian.
I think I'm definitely the oldest one on the call, so my history is long. But uniquely, my dad was a firefighter and started the ambulance service, volunteer ambulance service on the west side of Denver back in the 70s. And so what got me interested is in healthcare. I was always interested, but he would teach the first responder courses for the firefighters. And when I was in sixth grade, he asked me if I wanted to do the class with the firefighters, and I was 12 years old. And so I did the first responder course right next to the, 18, 19, 20-year-old firefighters. And then I was kind of hooked. And there were no physicians in my family, or, most of the folks that went to college in my family, my a few aunts and uncles were all teachers, which is great. But nobody passed college. So then I went to EMT school my last semester of college, or my last semester of high school. So I took my state EMT exam the Friday before I graduated from high school. And then I worked as an EMT in the summer and then a little bit at a hospital while I was in college. I always wanted to go to medical school. I got into medical school my first year, my first try to University of Colorado in Denver when it was at Denver, not out at the Anschutz campus. And went to medical school, got I had lots of interests and thought I might want to be a pediatric surgeon or something like that. But I also had an interest outside of clinical medicine in healthcare leadership. So I chose anesthesiology as a specialty. Part of the reason I did like physiology and cardiac, and I like being in the operating room. It's very busy. Um, Go into an office every day. I learned in medical school is not what I wanted to do. There's lots of people that's very important, and that wasn't me. I need to be in the action all the time. But one of the things about anesthesiology is you can do it a few days a week, or you can kind of ramp up and ramp down and then do other things as well. So when I finished residency, I was the chief resident, so I managed the schedule, managed any resident problems, was a liaison between the faculty and the residents and all of that. And ended up doing an administrative fellowship with the University of Colorado Hospital. So I was the first fellow at University Hospital and the only one to this day that's been a physician. Most of them are MBA or MHA graduates. And so I was in the healthcare MBA, Master's of Business Administration program right after I finished residency. So I was part-time faculty, part-time fellow for 2 years, and then earned an MBA in healthcare, and then had a mixed clinical and administrative role for ever since. And so I was faculty at University of Colorado for 8 years, and then I went out to Grand Junction to be the chief medical officer and still practice a little bit. And then I actually, 14 months in, the president of the hospital left, and they asked me to be the interim president. And then I became the full-time president. And so I've been the president of a large hospital, the only physician president of a hospital in the health system that I was in, which was SEL Health. Came back to Denver and then led Banner Medical Group for the whole Western region. So about 450 providers, both APPs, nurse practitioners, PAs, physicians, et cetera, across 6 states, all the way up into Wyoming. And then moved over to the payer side. So I now work for a nonprofit health insurance company doing population health across 9 states. So I have the entire Western United States. So everything from I've got Texas, Oklahoma, Colorado, New Mexico, New Mexico, I got your state, Arizona, Utah, Nevada, Oregon, and Washington. So I cover all of those states for Medicare Advantage, and I still practice clinically with Kaiser Permanente. I was actually on call last night and went to St. Anthony's Hospital. I got woken up at 11:30 p.m. Went to take care of a 70-year-old lady who slipped on the ice and broke her ankle and needed fixation and reduction. And I got back home at 3:30 a.m. And so then that's like my little part-time job. So then I had meeting at 8 o'clock a.m. So I was right back at it. So this is what it looks like when you get up in the middle of the night and then you still have to work all day. So my wife, we met in residence. She is actually a high risk obstetrician. So she went to OBGYN residency, University of Kansas College, University of Kansas Medical School, first physician in her family as well. All of her family members are teachers, by the way, and all of mine, except for my parents, are teachers. And some of them went to UNC. But she did OBGYN residency, and so we met on labor and delivery. And so she was an OBGYN resident, and I was an anesthesia resident. So we're up there together a lot. Um, and then she did her fellowship for 3 more years. So she finished training at 33 years old and as a maternal fetal medicine physician at Kaiser Permanente. So that's kind of my path. So I did healthcare and healthcare administration and business, and now I do both.
Perfect. Sounds great. Thank you so much. Okay, so let's go ahead. All right, let's go ahead and go to the next question. So, anyone can chime in if you have an answer to this. We'll just go like that from now on. So, how do you ensure that the care you provide is equitable, culturally responsive, and accessible to diverse patient populations?
I can start. Having diverse representation in my own identities, as well, I would say that using my identities in interacting with patients similar to myself is a good way to navigate. What I've always told myself is that in understanding my identity, to just kind of put my badge metaphorically away. I mean, not fully taking it off, but just so that they see me as a person as I see them, and they don't see me as a medical assistant or phlebotomist or at the time CNA. And then I would say just because in creating that power dynamic, sometimes patients aren't as trusting in what you do, and then adding in maybe there's a language barrier now. Um, they get even more hesitant at times. And so, in having the privilege of being able to also speak Spanish, I've learned as an MA, just when I call them and I pronounce their name correctly, and they're like, "Ah, Mija, yeah, you said it right. Do you speak Spanish?" And I'm like, "Yes, I do." And they're like, "Oh, perfect. Let me actually tell you then what's going on," and not, sugarcoat and accommodate to um, what maybe we're raised into thinking, speaking from a Hispanic point of view. So I would always say also just understanding the grave reality of what's going on around us, not letting it affect us to the point where it inflicts in our practices, but just understanding what's going on at different levels, socially, politically, educationally, all of that. Re-guiding yourself into however you need to adapt in those spaces, but also for your patients. So you accommodate to them, not letting them accommodate to you because they're already trying to accommodate to whether specific Western techniques, a new city, and a new language. Make it so that you can provide to them more than just the services in healthcare, but also that empathetic and cultural understanding that they don't have to change that aspect of themselves just to accommodate you. For sure.
Perfect. Thanks. Anybody else for this question?
I'd say this topic for me was a big eye-opening reality. I graduated from college in the last century, so I'm not that old, right? I'm only 48, but so that's still kind of young. But I grew up on the west side of Denver, in Wheat Ridge, largely white Caucasian area. And so when I went to medical school in Denver, and we did rotations at University Hospital and Denver Health and the VA Medical Center, it was eye-opening to me. It was the one, and many of my classmates. It'd be the first time we were in such a diverse uh, population, not only ethnically, racially, et cetera, but also just socioeconomically. Um, and so that was fascinating to me. I very much enjoyed being at Denver Health University. And it was a lot of learning. And I think part of being in healthcare is you got to want to learn about people from all different backgrounds and be willing to think about things and learn about things that you didn't grow up with necessarily. And that was how it was for me. And it was a great learning experience and still is, right? So I cover now 9 states, everywhere from Washington to Texas and in between. And we have lots of diversity in those areas. But I still go back to, medical school and residency and being faculty at University of Colorado Hospital, which is, I think, uh, aside from Denver Health in the metro area, probably is still has probably one of the most diverse populations um, uh, around. But anyway, that's kind of my old person history and in that. But I think, listening and being open-minded to other perspectives is key, because one of the things I learned in medical school that when you're in the operating room and everything, everybody's blood is red, and all your organs look the same, no matter what your skin color or anything else looks like. And that's a realization, a very human realization that you get to learn when you're that in depth with people.
Definitely. Okay, thank you so much. And then last but not least, Sophia.
I agree with both Brian and Jessica. I think I've incorporated both. I don't want to reiterate everything that they've already said because I think as like someone in healthcare, we all try to do both of like or what they've both talked about. Um, I think it's also super important, and I think we all do this, of like getting on the same level as our patient and not making it more of like the power dynamic that Jessica mentioned. Trying to make them feel comfortable, and we're in situations where our patients are either like experiencing one of the worst moments of their lives, and it's our job to fight for their care regardless of outside noise and anything else that may be going on to keep our patients safe. And that's how I strive to practice every day, regardless of anything else going on. I want my patients to be alive when I get there and alive when I leave. And hopefully, if they can have a good outcome going forward, and I just pay or do my time in the 12 hours I get to spend with them. But I think it's also super important to make them feel like a human and not like focus on other factors. Like I'm just genuinely there to care for my patients and help them in the way that I know that I can.
Perfect. Thank you so much. All right, let's move to question number 4. So, what skills, clinical, interprofessional, or administrative, have been the most important for your success in healthcare, and how can students start building those skills now? We'll start with Brian.
Whoops, sorry, I was on mute. I'll try to keep my answer shorter. I could talk all day on this one because I learned a lot along the way. But I would say as a student in college or shortly thereafter, the interpersonal relationships you have with other people, being involved in things that maybe aren't fully healthcare related, will really help you develop. The one thing that I didn't realize going into healthcare that I wish I would have done because I became very fascinated with it after the fact is you should take a microeconomics class and learn about resources, and whether it's US resources or just how things work in society and money and how things flow and how people make decisions. Um, there's a lot of sociology and economics in healthcare. And a lot of the challenges we're facing have to do, and there's so many healthcare professionals that do not have a basic understanding of basic microeconomics and how things have been for centuries. Regardless of what country or continent you're on, there's a basic economic principles. And if you learn those early, you can be more understanding of what's going on, be able to solve problems in healthcare because you understand the basic economics in addition to all the other, clinical and sociologic factors. But once I got into the MBA program and I took healthcare economics and basic economics, oh man, it's fascinating. It's absolutely fascinating.
Definitely. Thank you so much. Okay, Sophia?
As a nurse, I think when I was in nursing school, I'm a nervous person in general, but in nursing school, I think I was like, oh, I'll just like watch and experience it versus like pushing myself to try and get into situations more to like actually do tasks when I was in the clinical setting. And now I do skills that I was too afraid to do when I was in nursing school because I put myself in the situation where I had to do it. And I wish I had done that more in nursing school and pushed myself a little bit extra to really like say, hey, can I try and do this? And I think anyone who wants to be a nurse or wants to go to nursing school, make sure you like try and put yourself in those situations in a clinical setting to just get the most exposure, because it helps you figure out things you like and things you don't like. And it going forward, it also helps to ease the anxiety because you've done it before with somebody watching you and those kinds of things.
Perfect. Thank you. And then last, we have Jessica.
So I would say I have two skills that come to mind. So one being funny, and two keeping connections with different people, but not in the way you think. So starting with one, being funny, for ways that you can improve and start that now. I'm not saying learn how to be a stand-up comic in the next 48 hours, but just kind of things that, can give you that refresher in difficult, days or difficult patients and just overall, and just finding something that, makes you laugh or gives you that little giggle to kind of reset yourself and be like, okay, let's keep going. Like, focus on my patient, focus on what I got to do. Let's get back to it. Because there will be days where, you'll have mean patients or you'll have something going on at home that may still, come to mind and affect you throughout the day. But finding that one little thing just to bring back that smile and release, you know, that dopamine to you to just keep going will be a great way to ensure your success. So even if it's something that you don't think is funny, because I have a lot of, you know, dumb little TikTok sounds in my phone that I'm like, yeah, that's the funniest thing. But I'll show like my husband, and he's like, that's so dumb. So just finding what makes you get that giggle, and then in keeping connections. While yes, it's important, having those higher up connections to not only help you climb the ladder, but also keep you connected in your current situations. Also know about all the connections, um, those below you, but also that you may not think are worth connecting to, but are very important. So what I would always say is, like, from an MA standpoint, becoming connected with like my janitorial staff in the clinic, because then when we were told, hey, you can't use the mops because the janitors won't let you, in knowing the janitorial staff more than just the people that take out my trash and the people that take, the shred bins out at the end of the nights. One time when a kid threw up, and I was like, I don't think paper towels are going to do us justice here. I ran into someone and I was like, hey, look, I know we can't use the mops. Can I use the mop? And they're like, for you, you can use the mop. I'm like, yes, I can clean the throw up better. So just kind of having those connections and keeping that humbleness to everyone, regardless of what title they hold.
Perfect. Thank you so much. Next question. So, networking and mentorship are important in healthcare. How have you built professional relationships, and how have those connections influenced your career growth? And we'll start with Sophia.
Starting when I was actually in nursing school through clinicals, I had different preceptors at each of the hospitals that I did clinical rotations at. And my biggest connection ended up being through Children's Hospital, where I work now. And that helped me ultimately get my job where I work currently. But aside from that, I actually met my best friend in nursing school at UNC. And she's also a nurse. And we just talk a lot about like different opportunities. She's had a couple of different jobs, and I've stayed at my spot, but we talk often about like different opportunities, both like in an inpatient setting and an outpatient setting, just to like almost like we kind of keep each other in check of like, do we like what we're doing? Do we feel joy from what we're doing? And it's not just a job. It, it like we both like to be passionate about what we're doing. And I think that that is super important as far as connections go. Um, and we also know people from nursing school that we can stay, like our nursing professors. I know that especially my best friend has stayed in touch with, and we have connections for other opportunities. And nursing is has so many opportunities within itself, um, to be able to expand and move in so many different routes than just being like an inpatient or outpatient nurse.
Perfect. Thank you. Jessica?
So I've been able to build connections just by asking questions. I know sometimes it's hard because people that hold those titles with a bunch of letters at the end of their name, you're like, I don't want to bother them, but bother them. You know, they're more bored than you think sometimes. So just ask them questions, whether it's asking for a letter of recommendation, how they're doing, or how to better your role in whatever it is that you're, helping them with. Just ask questions and not being afraid to ask anything because they can serve as an advocate, as your coworker or just someone that you might be shadowing or being mentored by. So just allowing yourself to have those doors open for you just by asking a question of, hey, can I come in and just chat with you for a little bit. And then another one, it's not my own personal story, but I always like to share it because it's a very, I don't even know what word to put it. It worked, but I wouldn't necessarily recommend it all the time. So, don't sue me. Don't get mad at me if it doesn't end up being the best way. But I had a friend in undergrad who scheduled appointments with different specialists. So, like cardiologists, pulmonologists, general surgery, asking as a patient perspective. And then when it came to the meeting or to the appointment, he was like, so listen, I don't actually need anything. I'm healthy as a horse, but I would love to shadow you. Can we do that? So it was a very rogue way to do it, but I wouldn't recommend it. Maybe call them and ask if there's shadowing opportunities. But I just always think it's a very, he's a doctor now. So, yeah, I mean, it worked out.
Thank you for that, Jessica. Okay, Brian?
I love that story. Uh, I think in healthcare, mentorship along the way, regardless of what you're going to do, is key. And people will help you. And to Jessica's, people want to help you. And sometimes they're just not asked. So be confident, always be respectful, but just be confident. You'd be surprised if once you ask somebody about how they got to where they're going or ask them for advice about where you are, people want to share. And often, as successful as some people can be, there's always, probably three to one failure to success ratio. And what they may want to tell you is what not to do. uh, and that's important too. And I would say mentors may not even be the people that in the role that you want to be. It's the people around those people. And there are many people along the way. So there's faculty members when you're in college, and then you'll go to a program, some other uh, your first job, your first boss, whatever it may be. You want to engage with them and try to get them to support you beyond just the next role. Really connect with them. And I would say too, healthcare is a very, very small world, and it's very much a team world. And having been at in Colorado healthcare my whole career, and then I've been responsible for other states, but I've been here. But for example, I walked into the recovery room last night with the patient in a hospital that I'd only been in one other time, because I was on call and we were covering different hospitals. But one of the nurses said hello, and we worked together at university when I was a faculty member before I departed to go to Grand Junction in 2014. So that's almost 12 years ago, and we remembered each other, and it was a connection. But those things happen in healthcare all the time, and so don't burn bridges. Make friends. Friends are always better than enemies, and ask people for help. Most people want to help you. They just need to be asked.
Perfect. Thank you for that. And I think the only thing I can add to that is the importance of being yourself and just being authentic in all of the spaces that you take up. I know especially for like interviews for professional programs, people run into a lot of um, like problems when they're trying to present themselves as someone they're not. So just remember to keep your authentic self and present that person always first and foremost. Okay, perfect. Moving this along. So, question number 6. Healthcare can be physically and emotionally demanding. What has been one of the most challenging moments in your career, and how did you navigate it? And we'll start with Jessica.
So I've run into a couple. The one that pops into my mind from most recent occurrence was when I was specifically a pediatric medical assistant for most of my time on the floor, and we would run into children that would have a little bit more difficult upbringings and situations that they were in. One of them being there was two little boys who they came in with their mom, and then like mom's friend essentially. Mom's friend had found them after she would drive by a gas station to and from work. We would always see them just outside this gas station. One day she stopped and was like, "Hey, what are you guys doing here?" And they're like, "Oh, we live here." They're like in your car or in the gas station? Essentially, they were living in their car and just kept it parked at that gas station. They had immigrated from Guatemala and they didn't really have any resources available to them. They were just kind of having some struggles. And so she took them in and they live with her now, which is a beautiful thing. And she brought them in for a physical. And routinely, what we do at our well child check visits as MAs, we have a general intake that we fill out, making sure they're up to date on vaccines, if they need referrals for any specialists and such. Um, but the way I navigated this one was a little bit different. I knew if we fell behind, we fell behind, because I mean, we do anyways, usually. But I decided to just take more time and, be a little bit more in tune as with the situation because this wasn't my routine. All right, in and out, here's your vaccine record, turn it into your school. This was a lot more. And so essentially we were able to connect them to with um, our specialists in clinic that give additional resources for food, housing, and different supplies that they might need. And then those two kiddos needed some vaccines, and mom was like, "Yeah, let's do them." And something I took on as myself for after a good amount of vaccines that I would give a kiddo, I started buying toys to give out to them because the stickers we have in clinic, I appreciate the stickers, but a lot of kids were giving me feedback that JoJo Siwa stickers were just not the move. They're like, "Girl, you guys got to change it up. It's not the most cool of stickers." And so I decided to just get some toys here and there as kind of more the cooler prizes, as the kiddos would always say. And for those two kids, I had one of those leapfrog learning pads that talk back to you in English and Spanish. And I was like, this is the perfect family to give this to. So I gave it to them and they're like, "Oh, cool. Like, we'll give it back at the end of the visit." And I was like, "No, you can take it home. Like, take it home. I don't want it. If you try to leave it here, I'll find you. Like, I won't. I'm not breaking HIPAA, but I don't leave it here. Please take it." And just the mom gave me that look, like without saying a single word, she just gave me a look where her eyes just said thank you. Um, and I took a moment in the room next door to just be like, "Okay, like we did it." We don't have to change the entire system, but as long as we can change it for one person, then that's really what keeps us going. And so it was difficult, and I totally cried. I was like, "It's not fair," but it kind of keeps me going to remember that it's those kind of patients and those stories that push me to hopefully become a physician myself.
Awesome. Thank you so much. Okay, Brian?
I'd say there's a lot of challenging things in healthcare, and there's a lot of rewarding things too. I think for me and some of my colleagues, probably in residency or so, is when you really start taking some significant level of responsibility for care. Have supervising folks and faculty members. But I would say the first couple of times that someone died um, during surgery or things that otherwise would expect to go well. Opens your eyes to the importance of your job and that learning, it's not a joke. Um, so I would say, probably that. And being a faculty member too, where you're with residents, students, that you're with them during those first times as well. I remember, and I'm still spent time working with him. He's an anesthesiologist in Denver. He's great. We had an individual come in who had a horrible intra-abdominal thing going on. Huge family there. This individual was from Iraq. I remember that distinctly. Nobody really spoke English well. They were at University Hospital. He was not going to survive. It was horrible. There was no way. We didn't do anything wrong. It was awful. Um, but I knew it, but the resident didn't know it, and so I had to kind of get him, through that. Um, so it kind of sticks around, even though it's not you. You watch other people in the education process go through that. But the reality of that is it allows you to like it's a job, it's a career, but it's serious, very serious.
Definitely. Thank you so much. And Sophia?
On the same kind of note that Brian just mentioned, in my field, we do see a decent amount of kids pass, unfortunately, because cancer is not a perfect science. And I also have had experiences like that where those are my tough days. And it could happen for one kid in the midst of trying to take care of another kid that's doing fairly well, and you have to keep it together, but also like you have to take time for yourself and to honor the moment of like your patient that may have passed, and just trying to find the balance. Like I said, what I do, there's no perfect balance. A work-life balance is always a um constant adjustment to find the right balance, and that's super important. And just like listening to what your body needs and like what your friends may need, and just being there for each other, because like Brian mentioned earlier, healthcare is like a small world, and you have your people in it, and you guys kind of have to take care of each other, because healthcare is like its own language, and the people in healthcare speak that language, and it's important to like be there for those people in those moments.
Yep. Thank you so much. Thank you everyone for sharing. We are going to move to our last question of the panel. So I'm going to read it really quick. What advice would you give UNC Bears who are considering careers in healthcare but may be unsure which path to pursue? And we'll start with Brian.
I'll try to keep it short. We're almost done, but I would say there are so many good careers in healthcare at varying educational requirement levels. Um, Check them all out, pay attention to everybody, ask lots of questions. There are things that, I spent 9 years on the state dental board appointed by the governor as a public member, non-dentist, and I started when I was a surgery intern. I didn't know anything about dentistry, but dentistry is fascinating. I might have been a dentist and all of the specialties and everything, but my wife will say one of the best jobs in healthcare as far as, financial return and just kind of good fun job. She works with great perinatal sonographers. So they do ultrasound, and then for some special extra certifications, you can do perinatal. They get paid extremely well, and they spend two or 3 years in a formal education environment, and then they practice. They're happy. They get to be with, most of the time, happy, moms and dads or whomever is involved. But I mean, these are six-figure income folks that love their job. And she's like, I didn't even know that existed. There's so many great jobs. I have one of my UNC roommates, his daughter is at CU Boulder right now, and she likes healthcare, but she likes business, and she wants to go work for a device company and be in marketing for, you know, hips and knees and all these kinds of things. And so I got her in touch with some of the folks that do that. That's healthcare too, but just do lots of reading and ask lots of questions. There's lots of really exciting opportunities that don't take 12 years like me to do it.
Perfect. Thank you. All right, Sophia.
I would say, kind of like Brian mentioned, like just explore any opportunity you have to see what you like and what you don't. And also give yourself grace because it may feel like a very heavy decision, but it's like if you feel called to do it and you enjoy like things that you've learned about this area and all of that, like there's so many different paths and routes that you can do things in. It may just take time to get there, but just try to have fun along the way because I can honestly say I did cry a lot in nursing school, but it was all for the joy that I have in my job and I look forward to going to every single day. So it just takes a little time to get there, but just enjoy the ride for it.
Perfect. Thank you so much. All right, Jessica.
So some advice I'd give if you're unsure as to what you want to do, kind of go back to the root and ask yourself why you want to do it in the first place. So in finding your why, you'll end up finding your where. You'll end up where you need to end up. I always say that like no surgeon, no specialist just became one because that would be like a fun hobby to do. And if they do, that's crazy because that's really expensive hobbies. Like let's go to gardening at that point. But no one does it just to do it. They do it with a purpose, understanding their why, their driving force, their perspective. And as my parents say, by echándole ganas, so giving it your all, you'll find your way. All the healthcare professionals that you aspire to be, they found their way in, and you will too.
Yeah, thank you so much. I think the only thing I have to add to this is attending, panels like this and attending other talks and just reaching out to individuals that have a background in whatever you're interested in is how you get your foot in the door. So it's scary at first, but you're gonna have to do it if you are really wanting to pursue a career in medicine. So just, ask the questions and reach out to folks, even though it's really scary at first. All right. Thank you, everyone. I'm going to go ahead and send this back to Teresa.
Thank you so much. Thank you to all of our panelists, our moderator, and to all of you joining us today. It is always an honor and a pleasure to host fellow Bears and hear about their UNC experience, unique identities, career paths, and industry insights. Throughout the semester, we will be hosting more virtual alumni career panels. You can learn more by visiting www.unco.edu/alumni/careers. And before we end, we have our colleagues over from the Center for Career Readiness.
Thanks so much, Teresa. Hi, everyone. My name is Jessica Espinosa. I use she, her pronouns. I graduated from UNC in 2016 with my bachelor's degree and again in 2018 with my master's degree. And I'm now a career counselor at our Center for Career Readiness on campus. Here at the Center for Career Readiness, we support students with all things career while they're here, and as well as 3 years up to 3 years after graduation for our alumni. Our office connects UNC Bears to quality on-campus, community, and national employers through the Career Tool Handshake and hosting on-campus career fairs each semester. One of which is in 2 weeks on February 12th and is free to all students and alumni to attend. And you can visit Handshake to register and see which employers will be at the fair. Students and alumni are encouraged to schedule an appointment with our career counseling team for resume and cover letter reviews, job internship and grad school support, and mock interviews, networking tips, and more. We offer drop-in hours as well as job fairs and workshops throughout the semester. Further information on all of this can be found on our website at unco.edu/career-readiness, or you're welcome to email us at career.readiness.unco.edu.
Thank you so much, Jessica. And now I'm going to ask everyone to unmute themselves really quickly. And on a count of three, we're going to do Go Bears. 1, 2, 3. Go
Go
Bears!
Go
Bears!
Bears!
Thank you so much, everyone. Have a great evening.
Thank you.